So good evening. I am the last batsman of this wonderful innings, and thanks to Dr. Umesh Khanna for keeping this topic. We are moving from science to ethics, and ethics is not a science. And as I go through this presentation, you will come to know that ethics is one of the most important part of your clinical research, which is often ignored. And this is just summarized in 2 or 3 lines, as Madam has said, that we followed this and we have taken informed consent. But it's not like that, and you will understand the importance of ethics at the end of this presentation. So what is ethics? So ethics word is derived from a Greek word which means ethos. So it means a custom or character. So it has nothing to do with science. It just means it shows your character. So ethics as such is a systematic study of values, principle, beliefs and opinion, so as to decide what is right and what is wrong. So actually there is no absolute value to it. It is just a subjective value that something for some person may be right, for another person it may be wrong. So it is a subjective value, but once one knows in their heart that this is right and this is wrong, isn't it? We all know that what is right and what is known, and that is what is last line, that it comes from within. Unlike laws which enforces you to follow certain rules of the society, ethics comes from within. So what is clinical research? We have been talking about variety of clinical research since morning, and you have gone through observational studies to RCT and to meta-analysis. All these are clinical research. So the goal of clinical research is to generate a useful knowledge about our human health and illnesses using human participants. So wherever human participant is involved, we call roughly these are clinical research. So it can be anything from observational to this thing. So benefit of participants may not be the sole purpose of the research. So research question may be something else, like you just want to know the prevalence of the study. So benefit of participants may not be the sole purpose. It may be one of the purpose, or it may have occurred because you are closely following up the patient. It may not be your primary aim, but it does occur. So people are mean to developing useful knowledge. So you are using human participants to develop some data or develop some knowledge, and that is why they may be subject to risk of exploitation. How? We'll come to know. So ethics in clinical research. So basically what we mean by this is that we minimize this exploitation, we minimize the harm to human participant, and we maximize their benefit. And we ensure that the right and the welfare of the participants or the human subjects or human participants are respected. And this is a long history. It all started from World War II, and I'll show you some of the pictures of that. And it all started from there, and how this ethics came into human experimentation. So it first started with Nuremberg Code in 1947, and then we all know about Declaration of Helsinki, which was first given in 1964. Subsequently, it has been revised multiple times. Then there has been US Code of Federal Regulation, then Melbourne Report, and then GCP guidelines, and then finally I'll be talking about ICMR guidelines, which are applicable to our circumstances. So what was this Nuremberg Code? And you see variety of pictures, and there are many more pictures which are available on net. And this was all happening in Second World War in Nazi camps, where the prisoners were subjected to lot of experimentation. Like in this picture, this person is being injected with seawater just to see whether seawater is potable or not, or whether the human body can survive with seawater. In this subject was subjected to seawater. He was just floating into seawater for hours and hours together, just to see what happens to body when it is floating into seawater. And similarly, this patient, this human participant, was just being elevated in an airplane for hours together. So a lot of these kind of things were happening during Nazi war. This is childhood phacomelia, when mothers were given some experimental drugs. So at the end of it, what happens was that a jury was conducted, and these are the physicians who conducted these kind of experiments. And at the end of it, something which was devised, which we call as Nuremberg Code. And what is this code? So the first time at the end of this Nuremberg Code came this concept of research ethics, and the first time it was mandatory to take a voluntary consent of human subject whenever they are being taken into any study. So this was the first time when a consent of human participant was made mandatory. Before that, there was no concept of human, taking consent process at all. Then obviously this declaration of Helsinki came by World Medical Association. First conference was held in 1964, and then a variety of times it has been revised, but the first conference, because it was held in Helsinki, the name is still kept as Declaration of Helsinki. And this was the declaration where first time ethics committee has come into role, right? So after Nuremberg, informed consent came into picture, and after Helsinki, ethics committee came into picture. So they have said that all protocols must be submitted to ethics committee for review, which the ethics committee should be independent of the investigator, the sponsor, or any kind of undue influence. However, when this Helsinki declaration was subjected, still there was one study, and this is supposed to be the most infamous biomedical research in the history of US, and this is known as Tuskegee syphilis study. And what was done in this study, so you understand, 399 black men. So first of all, there is some kind of discrimination, so only black men were taken into consideration. So they were thought to have syphilis, and they were recruited, and they were just kept into prospective follow-up to understand the natural course of syphilis. By the time this study was ongoing, penicillin came into picture, and in 1947 it was known that penicillin is an effective treatment for syphilis. However, the subjects were not informed that this now drug is being available, and they were kept on follow-up till 1972 just to understand the natural history of syphilis without giving any active intervention to these patients. And that is how this became the most infamous study. And after that, what have been done is this Belmont report has come by National Research Act or Belmont report of 1975, and there are three basic tenets of ethical research they have proposed, in addition to your informed consent and independent ethics committee. First is there should be respect for persons, and these three tenets should make the basic framework of whatever research study you are planning. So there should be respect for human participants. There should be principle of beneficence, like you have to benefit them rather than harming them, and there should be principle of justice. So this was the report of Belmont, and after that further reports of US National Code as well as GCP guidelines have come. So we'll talk in more detail about Indian framework, what are the ethical guidelines in India. So ICMR has been very active in issuing timely, guidelines about what we should be doing in clinical research wherever human participants or you are doing any kind of a stem cell or even animal research. They have been issuing guidelines. So from 2000 onwards, they have been issuing guidelines, and the latest guideline is this 2017 guidelines, and this is 700 pages detailed guideline. You don't have to go through all 700 pages. They have also summarized in a brief booklet which is around 47 pages, but brief is also 47 pages. So I'll be summarizing it in another 3 or 4 slides. So you should be thankful to me that I am actually summarizing 700 pages in 3 or 4 slides. So we'll talk about brief, what are the basic and essential aspect of ethics in human experimentation. And what they have said is you have to follow 12 principles always, irrespective of the kind of study, whether you are planning clinical trial, whether you are planning, observational study or whatever trial, you have to follow these 12 basic principles. And what are these 12 basic principles? First is principle of essentiality. So there are two things in that. The first thing is that whatever you are trying to do is essential to do. It is an unanswered question. Whether this is unanswered question in our circumstances. For example, voclosporin has been tried in USA but not in Indian patient, and I want to study voclosporin in Indian lupus patient. This is an unanswered question. So your research question is an essential question, and second is it is also essential to involve human participants. It cannot be done in any other way, like I can't take stem cells and do that kind of a study. So it is essential to involve human participants, and the research question is also essential. The second is principle of voluntariness, and this is, the informed consent, that the patient should be agreeing to participate in your study. There should not be any coercion to the patient, and you should also give an option to the patient that even after inclusion into your study, patient can withdraw anytime without causing any harm. Like they will not be denied any future treatment or future admission in your hospital. Sometimes resident may say कि तुम नहीं आओगे तो मैं तुम्हारा admission नहीं करूँगा या तुम्हारा अगले time पे hospital में इलाज नहीं होगा. So these are all unethical kind of things. You should not say like this. Principle of non-exploitation. What we mean non-exploitation is that if you are involving human participants in your trial, then you have to do some kind of adjustments or in your study, some type of protocols that what if they have subjected to clinical trial and something happens to that patient, some side effect has occurred, adverse effect has occurred, how you will be dealing with that, whether patient will be compensated, whether your trial is having insurance, whether the patient will be reimbursed for, for example, traveling, or or will you be reimbursing for the drugs or so on. So there should be principle of non-exploitation. The principle of social responsibility. The meaning is there should be no coercion of the patients, and also no inclusion of disadvantaged population. Like I have given you example of black men. So not only they should be representative of your society, you should not be having, so for example, poor patients, they are not able to get the medicine, and you are giving them a benefit that okay, we will be giving you free medicine so that they can come into your trial. So again, this is not acceptable. You have to have an equitable kind of distribution. You should not include only disadvantaged population. Then principle of ensuring privacy and confidentiality. That is privacy of participants as well as records, and also clauses when it can be breached. For example, you are supposed to have confidentiality of patients, whatever there, because patient, they may be sharing so many things with you, and you may know so many things about the patient, so you have to maintain privacy. But there are also clauses when this privacy can be breached. For example, your patient, during your trial, you have come to know that this patient is now suffering from, say, for example, HIV infection or HCV infection, or for example, any kind of communicable kind of disease. You have to breach that privacy for larger benefit. So you have to be clear that it's essential to have privacy, but there are also clauses when you can breach this privacy. Then you should also have principle of risk minimization, that you should have steps to minimize this risk, and also how to take care of this risk if these have occurred. Principle of professional competence, that the trial has to be conducted by professionals who are trained or who are having competency to do this study, right? It can't be. And that is the concept of having, thesis guide or mentors. We are not leaving just onto the residents that they are going unsupervised and doing whatever they want to do. So that is the concept, that it has to be supervised. And there is also, if you are doing clinical trial, there is concept of having GCP certification, good clinical practice certification, that you are complying with those guidelines. Principle of maximization of benefit is again same, especially it is relevant to clinical trials, that you have to have a good equipoise or randomization, so that you are not subjecting some group of patients to an inferior kind of or experimental kind of treatment. There should be a proper randomization to maximize the benefit to maximum of the patient. The principle of institutional arrangement, it means that institute where this research is being conducted should have policies for research governance, and also should have facilities, infrastructure, manpower, funds, and training opportunity for conducting research. It's not that in one room you can plan something and you can start doing something. It has to be in a proper setup of a institute or your hospital setup or whatever setup. Principle of transparency and accountability. What does it mean? That it should be done in a transparent manner. It should be disclosed, and we will come to that, how you can disclose that. There should not be any conflict of interest of any investigator, and the result should be made public, right? And the data, another important, especially for clinical trials, is that the data should be retained for whatever number of times number of years you have predefined in the protocol. Usually most of the trials say that the data should be retained for at least 15 years or more if you have conducted a good multicentric randomized control trial kind of a study. Then totality of responsibility, that all stakeholders starting from principal investigator to your resident to your sponsor to your ethics committee to your all the persons who are involved in the study are equally important and responsible for this, and this responsibility is not only professional, it is also social and moral responsibility. And finally, there is a concept which they have kept this time, is that environmental protection, that you have to have good biomedical disposal kind of policies and things like that. So these are the 12 basic principles which should guide you in conducting your clinical research. And another two important things and the two basic pillars of clinical research is, one is informed consent and second is an institute ethics committee or an independent ethics committee. So what is informed consent? So subject should be giving you consent to participate, and as I have told, there should be no coercion or no, you should not give them any kind of falsification hopes or something like that. They should be fully informed about the objectives of the study, and they should be given right to withdraw anytime from the study. And also equally important is the PIS, which is patient information sheet, which should be the part of your consent process. Both consent form as well as PIS should be in the language which the patient understands, and the PIS should be given to the patient. You should not be lying with your signed consent form. The PIS is for the patient, so you have to give it to the patient to read it before they actually sign the consent form. Even after signing, the PIS has to be kept with the patient only for their future reference. And this is the table, important components of ICF, what should be there, which are as per ICMR guidelines, that your ICF should have all these kind of, and these are mandatory. There are some things which are optional also. So your aims and studies, why you are doing this research, what the patient is supposed to do, will he get any benefit, monetary benefit, medicine benefit, yes, no, what kind of, who is the sponsor, and also whom they can contact in case of any problem. That should be there in your consent form itself, like contact number of not only your the resident but also the supervisor, that is the mentor, or the principal investigator, which is the faculty. Their consent as well as the consent of convener of ethics number of convener of ethics committee should be there. All these three numbers should be there in your consent form. The second important pillar is, and which is very, very important, is that institutional ethics committee. All clinical research has to go through this this ethics committee. Without their approval, you can't do any ethical, clinical research. So this ethical committee is basically what does they do is that independent review of clinical research to ensure the public that investigator biases have not distorted the approach, the ethical requirements have been fulfilled, and the subjects will not be exploited. So minimize the conflict of interest and improve the public accountability. So as per the GCP guidelines, the institutional or independent ethics committee is an independent body constituted of medical, scientific, as well as non-scientific members whose responsibility is to ensure the protection of the rights, safety and well-being of human participants who are involved in this clinical study. And they should not only review the beforehand, but they are also supposed to have a timely review of this study at a timely interval, and also to document whether the informed consent process is proper or not. So things like that. And so this is what I have said already, that these are the jobs of independent or institutional ethics committee. So just their purpose is that they have taken care of biases, they have taken care of exploitation, they have taken care of proper informed consent process, and they are also reviewing on a timely basis. So as per ICMR guidelines, these are the composition of ethics committee member. So there should be one chairperson, which should be preferably out of your hospital or your institute. So as unbiased as possible, this institute, this committee should be there. 1 to 2 basic medical scientists, 1 to 2 clinicians, 1 legal expert, one social scientist, one philosopher or ethicist, one lay person from community, and there should be one member secretary who can be anyone out of these or independent. So this is the brief composition. So roughly 10 to 15 members independent ethics committee should be there as part of your clinical research. However, this was the ICMR paper published 2012, so around 12 years back, I think, but most of the things are still true in our country, that many institutions do not have IEC, independent IEC. So what is happening is that there is one IEC which is regulating, 4 or 5 or 10 or 15 hospitals. There is one independent ethics committee which is reviewing. So many institutions do not have their own independent institute ethics committee. They don't have written SOPs, although ICMR has given written SOPs, but they may not be aware or they may not be following it. They may be paucity of trained personnel to work for ethics committee. And one of the things is that they may not be, this is out of their whatever job, they may not be paid for doing this kind of job. So what at PGI, at our institution, although we are government institution, what we have recently started, our institute has recently started, is to charge. Earlier we were charging only 10% or 15% overhead charges for clinical trial. Now we have also started charging 5% of the total budget as ethics committee charges. So this is just to promote, people. So we will not be obviously paying. So somebody who is coming from outside, we will be able to pay, but somebody who is already in the institute, we may not be paying. But this gives an seriousness into the ethics committee process, that okay, we are also charging, so we have to meet and we have to follow this thing. So all these things are lacking in this our circumstances, which needs further improvement. So I was talking about that data should be made public beforehand, and one of the way the government has come out is this Clinical Trial Registry of India, which was established in 2007 by ICMR, National Institute of Medical Statistics, and now and this was also approved by 12 Indian medical journal editors. So now what they have decided, that if a clinical trial is not registered in CTRI, they will not publish in their journal, and that is how they are enforcing people to register. The another thing what has enforced is DCGI. So whatever clinical trial are going for approval of DCGI, like to start in India, it is mandated to be registered in CTRI, number one. Number two, it is mandated to be registered prospectively, before recruiting the first patient. So you have to register it beforehand, and in this registration you have to give their ethical approval of your trial. You have to declare who are all the PI, whether it is single center, multiple center, if there is multiple center, who are the PIs of different centers, and what you are trying to do, what are your inclusion, exclusion criteria, primary endpoints, secondary endpoints. Everything goes into the public forum. It is public, it can be accessed by anybody in this CTRI. So this is one way of bringing transparency into the system. And this is final slide, that despite whatever government and the ICMR is trying to do, we still are a complex society, we all understand. And we are a large developing countries, and we have a lot of diversities, be it socio-economic diversity, be it diversity in terms of education of the patients or the healthcare facilities which are available in our country. There is so much of diversity, and these all diversities makes patient prone to exploitation. So we have to understand as clinician that in these terms of this diversity, we have to devise a system that we minimize this exploitation and we avoid the conflict of interest. Another thing is that you must have read multiple times in newspaper that people are not believing research coming out of India, or patients are not believing to enroll in your study. We are also part of so many clinical trials, and sometimes patient actually ask us कि सर कुछ हमारे ऊपर क्या अलग से रिसर्च हो रही है क्या हमको. So this is what is known as guinea pig kind of perception, कि मेरे को ही क्यों चूज किया, मेरे ऊपर क्या अलग से आप करने वाले. So this is the mindset कि कुछ अलग से क्या करने वाले हैं हमारे साथ में कि हमको ये ट्रायल का पार्ट बनाए. So all these are mindset of our people, not only doctors but also of patient and also of society as well as the larger framework of our society. So these are the complexities of our Indian system. We have to deal with it, and we have to, that is why ICMR is within this framework, considering all this complexity. They have tried to given these guidelines so as to follow this, to be followed by all of us whosoever are doing this clinical research. This is my take that despite all these guidelines, there is some breach happening every time we are coming to know through media and papers. So do we need actually law for this? There were somewhere in 2015 there was some medical bill for clinical research. I tried to search the literature. I could not find the detail of that medical bill. I don't know whether it has still become a law, but there are some clinical trials at least which are regulated by DCGI and which are well regulated by DCGI as well as CDSCO. So, but I am not sure. I have tried to go through the Google. I am not sure whether it is still a law and whether we require a law or not. Because, you know, as I have said, ethics comes from within. It is not a legal kind of thing. So, as to conclude, ethics in clinical research is still a naive subject, and I am very, very thankful to Dr. Umesh Khanna for keeping this subject in research methodology workshop, because in research methodology workshop, you know, we are always debating about p-value and statistical method, how to analyze, how to write, but this is very, very important aspect of your clinical research as such, not only writing the paper but also designing and implementing your research. So India is emerging as a hub for clinical trial, and we all have observed so many multinational clinical trials have come to India because we have large patient population. And that is why multinational companies want to come to India, but we still require a strong legal administrative framework to regulate this issue in clinical research. We still lack manpower, adequate manpower, infrastructure and training in this aspect. Finally, if you keep these two things in mind, I think you will be doing good in this aspect. First is always keep your patient's interest above anything else. And this is what actually is, I am also telling my resident that if you do these two things, you will always be on the right side of ethics. First is always keep your patient's benefit first, and second is always have this principle of do no harm. So if you are doing these two things, I think you will be on the right side of ethics. Thank you very much for the patience.
Thank you, Dr. Manish. You gave an extensive review of everything starting from the history. Some of the historical aspects which still remain is that many people would know that what we today call granulomatous polyangiitis, part of the reason for the name change is that Wegener, whose name was included in it, was removed because he was part of the Nazi experiments. The second is that even Dr. Sims of the Sims speculum fame, his statue in New York was recently removed because he was also found to have experimented on black women in the 19th century. And one of the excellent reviews of this is Rebecca Skloot's book, The Immortal Life of Henrietta Lacks, which deals with how the scientist looking after her had preserved her cells without informing either the patient or her relatives, and it was discovered by a reporter several years later. Just as recently as last week, the government of India, I think, has removed the need for a trial of something which has been already tested in other countries to be repeated in India before the drug gets licensed.
No, actually for 12 diseases, what they have said is there is no need to conduct phase 3 trial, but it is still mandatory to conduct phase 4 trial only for those 12 diseases which they have specified that these are the diseases, and they have to be approved by FDA or European standards.
So, but that's at least a step forward, that unnecessary repetition of those trials would not be done. The National Board.
That was true for the academic trials only.
Yeah. No, this is for drug trials now, which he's talking about. And now even the NBEMS has mandated that every student's thesis also has to go through registration.
Yeah, that is being followed at PJ since last many years.
But now this has come to the NBE, I think about 5 years ago, 5 or 6 years ago. And of course, you stress that the importance of ethical practices in research, but unfortunately there are many parts of the world where even ethics in clinical practice is still not assured. There are reports that China has used kidneys from prisoners on death row for transplantation. There are countries where the governments oversee paid donations.
Couple of things. One situation which we often come across is someone claiming that the study has no ethical issues, so it doesn't require an ethics committee review. Which if you look at the rule of the land order is wrong. even if there are no ethical issues, what you are supposed to do is to ask for waiver of consent. See, it has to go to this committee. So whatever study we do, it has to go to this committee.
Yes.
When it is not, ethical issue is not there, you will ask for waiver of consent. So that you can ask for
Yes,
waiver of review also. There is an option for waiver of review, but it has to go. Ethics committee has to say that review is not needed.
So the typical example is a retrospective study, where, pathological or retrospective study.
Talking about that part is we are actually seeing the opposite of what is generally happening. Because our administration went into the other side. The ethics committee, I think there is a problem when the ethics committee has a lot of people who are not medical people. So the issue we are facing frequently, which has come down in last 1 year or so, was that even trivial issues, even for like the transplant data I mentioned, people, except for people who have died, they will say that you have to take retrospective data which you are taking only from medical records. It's not even we are talking to the patient, because we have a registry. Our ethics committee people used to insist that you have to take consent from patients, which is not existing anywhere in the world. Okay, so my point is this, and I think some of them genuinely have a belief that some of the things which we do are have ethical implications, which is not, because they have no medical training or medical background. So that I think also is something which I think more and more people will start facing.
Yeah, I agree with you, because people sometimes become, go overboard, they try to implement, and when you give power to somebody, so with power comes responsibility. They may or may not be responsible. It is just a reflection of the society. This is happening at PJ also. I think this may be happening at other places also, but my basic principle is, if ethics committee has put an objection, we have to look into this and we have to sort that out anyhow, rather than arguing or fighting with them. It doesn't help. It doesn't help.
So what has happened is many people have had to abandon their project because it was so unaddressable issue. And this issue 1 year, I didn't go into that because you brought it up, has changed with the secretary, because when there is a very headstrong person who is into implementing things when he doesn't know also, that becomes an issue. So we need to choose the right person for the ethics committee. External person. Okay, that is what also used to happen.
I think it is in the fitness of things that Nitya has the last word.
One small thing which I think was the ICMR, which I think all of us also need to know, the level of risk. Minimal risk, less than minimal risk is there in the ICMR thing. So based on that is what you decide. What is, when we write the ethics committee application also, you need to mention whether it is less than minimal risk or there is significant risk. Based on that, the evaluation will change. Thank you.
Dr. Manish, thank you so much. I enjoyed your talk. Just 3 points. The Declaration of Helsinki has a October 2024 new edition.
Okay.
So it was in the public domain. So when we do research going forward, it's going to be the 2024 guidance. So that would be nice. What I didn't touch upon, and Sir touched upon briefly, is we have ethics related to medical writing also. So the British Medical Journal, in my opinion, has fantastic guidelines. I find the UK guys are better than the US in terms of 1, 2, 3, 4. It's very clear. And the last, sir, is accreditation of ethics committees. Accreditation of institutions actually brings about a lot of improvement in quality.
So I think it has been made mandatory or not, because I was reading somewhere that it has been made mandatory, the accreditation of, as well as registration also.
It happens, I'm telling you, the institute will say, we are NABH accredited, so we will not accredit our ethics committee. That's what is happening. So the ethics committee, NABH accreditation should be set. So I think that's
yes.
And I think I'll just, Dr. Khanna, end by saying that I read this long ago. Ethics is doing the right thing when no one is looking. Yeah, so I'll hand it over to you. Thank you, Dr.
Thank you so much. Thank you, Manish. Thank you, chairpersons. It was